It's now time for Ask the Expert. Along with Valentine's Day, yesterday was also Donor Day.
Yeah, so joining us live this afternoon, Dr. Ajay Sahajpal with Aurora Healthcare to explain what that means. So Valentine's Day is also Donor Day?
Valentine's Day is also Donor Day, yeah.
It's a good day to pick, I guess, people thinking about love and, you know, helping others, and being a donor is the ultimate gift to someone you may love or not even know. So tell us about the experience that you've had with this.
Sure, it's also a good way that I can remember Valentine's Day, so my wife likes it. So National Donor Day is something that the transplant community and Health and Human Services came up with in the late 90s, really to accomplish a couple of goals. One is to highlight the amazing gift of life donors give and highlight the donors and their families. And the other is to highlight the need and the fact that the number of people going on the waiting list for organs in this country, life-saving organs, is going up, but the number of donors has been relatively steady. And so we're really to highlight the need for organs.
Well, I like how you said that, you know, this is a way to acknowledge and appreciate those who have given the gift of donor. But how big is this gap you speak of?
So to put it in perspective, there's about 120,000 people in this country waiting for organs. And there's about 30,000 transplants that were done last year in this country.
What's the number one need?
That's a good question. Kidneys would be by far the biggest solid organ need that's out there in terms of.
I guess I was going to guess heart, but you know, I would just think that would be. And the thing with kidney is good because people have two of them, right?
People have two of them, so you can have live donors, you can have deceased donors. With hearts, it's interesting because of the advanced support technology and devices, like Dick Cheney, for example. It's changed the way those patients, their allocation needs and their needs. We can actually bridge them a bit better and safer.
How can people participate more in this donor day and or year? Because a lot of times I think that, okay, either I need to put it on my driver's license, and so it's something that I give after I pass, but you also mentioned they're live donors as well. Yeah,
so for deceased donors, it's your driver's license, or you can register with the state. For live donors, I mean, for kidneys, for example, a lot of people hear about it in church groups, or I've had patients that are, you know, meet in the pharmacist's office, meet at the dentist's office, and for coworkers that donate. So I think anyone can be considered as a donor, and so it's an amazing thing when you see it happen. Actually.
And it is an amazing thing, and it's one thing that probably doesn't come up at the dinner table, but you should have this conversation with loved ones, shouldn't you?
Yes, it's especially if your loved one is waiting for an organ. And being on dialysis, for example, since we're talking about kidneys, that's a conversation you really should have at the dinner table and be open about.
Well, appreciate you coming in, talking about it.
My pleasure.
Thank you again. And don't forget, we're going to have much more on this. You can find out on our webpage. But if you have a question for our experts, email them at AskTheExpert at today'stmj4.com. You can also leave a voicemail. We do have the number right there for you.